A patient today came into the office and they stated that since starting a medication with me a couple of weeks earlier, they were having a little bit of upset stomach. The medication was called trintellix or vortioxetine, and just like all psychiatric medications, sometimes when people first start them, they might have a little bit of upset stomach or headache or just feel a little bit off, and those side effects tend to be transient, but they can be really distressing and or upsetting while they last, and so you want to try to limit them if possible. Well, anyway, this patient really wanted to continue with her trial, especially because trintellix was known to have much less of a risk of sexual side effects than your SSRIs or SNRIs. And this patient had significant problems with that side effect with those medications in the past. And they also understood that trintellix is it's known for actually improving motivation and energy and cognition as well for a lot of individuals who take it earlier than some of your other antidepressants may do so. And so what we talked about was, because this medication has a long half-life, a half-life is the amount of time that it takes for half of the medication to leave a person's system. So because this medication has a long half-life of about 65 hours, you can actually start off with every other day dosing. And when you start off with every other day dosing, that allows you to become accustomed to get used to a lower serum concentration of the medication in your system before increasing to everyday dosing. And then you allow yourself to get accustomed or used to that level. And then you can go to the dose that's recommended by your provider, for example. This is a tactic that can be used with a lot of psychiatric medications. But in general, you really need to can only do this with medications that have pretty long half-lives, because if a medication has a very long half-life, then even the days where you don't take it, you still have a significant amount of medication in your system, so you're still adjusting and getting used to that medication being in your system. Again, these videos are not meant to be medical advice for any specific people out there. They're just informative in nature, and so if you find this content interesting or applicable to you, please discuss it directly with your mental health provider, or call and get a mental health provider if you have difficulty with depression or are considering medication management for any psychiatric difficulties.